So I'm Jim Cashel. I'm fortunate to be speaking with Alain Enthoven, who is the Professor Emeritus at the Graduate School of Business at Stanford. And Professor Enthoven, you chaired a panel an hour or so ago about employers and health reform, which is obviously in the American system a huge issue. What were some of the key points that you and panelists were making about this topic?
Well, I think there are a number of very fundamental things that are wrong with employer-based system as a basis for health insurance. Not to mention the fact that now millions of people are being thrown out of health insurance because they've lost their jobs. But I always object to the fact, first, that employers do not offer choices. Most people, for whatever reason, good or bad, they come to work to Company A, and Company A says, well, we're with Aetna, and here's our health plan. And so, and we pay for it. Be grateful that we pay for it. So, the people don't have the opportunity to say, well, what are the alternatives, and could I save money if I chose something that cost less? Very few employers do what we do at Stanford, which is we offer 5 different choices. Chauvin talked about this. And we pay the price of Kaiser, which is our lowest price plan. Arguably the best quality because it's the best coordinated. The university pays for that, but you can have HealthNet or Pacific Care or a couple of Blue Shield PPOs, and they cost more, and that's fine if you want that, and you pay the difference. Well, so the result is 81% of our employees have chosen HMOs. You know, there used to be conventional wisdom, the American people don't like managed care. That's not true. If you let them choose it themselves and they have to pay the difference.
Cost sensitive.
They're cost sensitive. Then they go for that. So we talked about that problem. Then one of the big problems is that employer-based health insurance masks the true cost of people's health insurance. Just the other day, I had a reporter from a big newspaper who called me about something, and I just engaged him in a conversation about his health insurance. He had absolutely no idea what his health insurance,
he spent, right.
Yeah, what it cost, you know, what his employer is paying. And Dorian Ranella said, well, we send our employees a letter, or maybe it was Sally Wellborn, you know, we send them a letter and tell them what it costs. And we've tried to do that at Stanford. I think, you know, I leave from this meeting saying we've got to do a better job of saying the people who choose our PPO, you need to know that your family's health insurance for a year costs $22,000. That's a lot of money. And I think across this country, if people knew that what their health insurance cost, and if they knew it really is coming out of their pay, then they'd see it very differently, as Chauvin said. You know, this employer-based health insurance perpetuates this big illusion.
So we have an employer-based system that's a bit of an anomaly compared to other developed countries. How are we stuck with it? How realistic is it that, given what you hear in the current policy debates, that we move in a significant way away from that system?
I think it'll take a long time. You know, eventually, gradually, people may come to realize that that's not the best way to do it. A good model for what we might do is either the Dutch, or in this country, Senators Wyden and Bennett have introduced a bill to do about the same thing, which is 1, everybody has to buy health insurance. 2, if your income is low, on a sliding scale, we help you buy it. 3, we're going to have competition among all the insurance companies who participate. 4, you have to pay the cost, so you see the cost. And 5, we have what they call risk equalization. That is, that the government compensates the health insurance plans that get the worst risks, so they're not trying to escape sick people. And then they have to take whoever enrolls with them, same price for the same coverage for whoever it is, can't discriminate against the sick. So there are rules like that that are working for the Dutch. And
are you describing that as a step away from an employer-based system?
Oh yeah, this is completely away from an employer-based system. And Wyden and Bennett have a bill which is has bipartisan support. They have had 16 bipartisan co-sponsors in the Senate. You know, like any bill, it's not perfect, but it's a really good idea. They captured the essence of the right idea, which is people need to have cost-conscious choices, and if they do, what experience shows us, as at Stanford and a lot of other places, when they have that choice, very high percentages of them choose among the low-cost plans, which cost a lot less than fee-for-service. I've been promoting that idea for 30 years now because I think that's the way that we could eventually overthrow fee-for-service. We wouldn't replace it all with organized systems like Kaiser or the Palo Alto Medical Foundation. Many doctors could participate through something like Hill Physicians,
Right.
which is an individual practice association. And Hill has recently announced they've teamed up with Catholic Healthcare West and Blue Shield and made a deal where the doctors and the hospitals are to work together and guarantee the premium for the coming year will not increase over this year. And then they're going to work together to make that happen. And you see, the terrible problem in our present fee-for-service payment system is that the hospitals survive and prosper by filling the beds.
Exactly.
And they don't want something to happen to keep people out of the hospital. The best thing doctors can do for cost, in many cases for quality, is to work harder to keep
For
people
recidivism.
keep people out of the hospital. But the present payment system, as an article in the New York Times illustrated this last Saturday, punishes the doctors for doing that because a lot of the work is done by nurses and other non-physicians, but Medicare just pays for doctor visits, doesn't support all that infrastructure. Anyway, so on net, there are major problems with the employer-based system. Another thing is they compete. You know, Dorian Ranella from Nectar Therapeutics was saying very much what I heard also from a nice man at Genentech, and that is we're in the war for talent. We're doing everything we can to get really smart, capable people. And so we want to make our benefits all inclusive. We'll pay for anything, so there's no cost consciousness there.
It's a step backwards.
Yeah, I think so. And so sometimes I say to them, well, you know, we're competing for great scientists at Stanford also, and we have this model of choices and competition. And our great scientists, we haven't lost any great scientists because of our benefits program. I mean, after all, it's only money. You know,
Give them something else.
yeah,
Well,
give them the money, let them
Exactly.
choose it for themselves.
well, on that, thank you very much. I enjoyed speaking
Well,
with you,
it's fun
Professor
talking to you,
Enthoven.
yeah.
Thank you.